My name is Bagonza Steven. I'm a clinician working with Palm Healthcare in Kampala, Uganda. My dear viewers, if you're watching this video for the first time or you're visiting this channel for your first time, kindly subscribe, like, share, and click on the notification bell for more exciting videos when they are available. Today we will talk about physiological changes during pregnancy. Before we go far, let's talk about what pregnancy means. I hope everyone has seen someone who is pregnant, or some of you have already experienced pregnancy. So the term pregnancy simply means development of the offspring into the uterus or the womb. Eh? Development of these uh, offsprings. Fertilization takes place within the fallopian tubes. Then the baby comes, the fertilized egg comes into the uterus or the womb, where it is implanted and it develops into a new offspring of a male sperm and a female egg called the ovum. Now, the presence of this embryo that develops into a new offspring comes with a number of changes in a human body. Now, we want to look at these uh, changes that occurs. One of the changes that occurs is called amenorrhea. The term amenorrhea is a medical term to mean absence of menstrual flow. When you miss your periods, commonly known as periods, when you miss your flow or your periods, which normally occurs once in every month, it's quite better to visit a healthcare provider to find out what's wrong with your system. You might miss your periods due to other changes, but which might be uh, uh, in need of you to seek for medical attention. Because it can be disease, it can be hormonal changes, but the common cause is always pregnancy. When fertilization takes place at around 7 to 9 days, a hormone HCG is produced by the growing fetus. This hormone uh, is what they look for when they are testing for pregnancy. This hormone is known as HCG, or human chorion gonadotrophic hormone. It comes with quite a number of changes with other hormones like hormone progesterone and hormone estrogen. This change in these hormones, they cause uh, a number of physiological changes, one of which is called mood changes or mood swing. This is why you find a woman during her normal periods or normal times has no problem. But when is pregnant, he will be selective in people she likes. Where you find some women, they hate their husband, some people they hate their relatives, some women they hate uh, visitors. When it comes to the digestive system, they become picky, where they love a certain kind of food and hate some foods. Some prefer eating clay soil or this common soil. Uh, that's due to those hormonal changes that gives them selective in some things. During pregnancy, there is increased blood volume. The blood volume increases, but uh, the HB sometimes it increases, but it might be a little low. In a normal human, female human, in average, they have around 5 liters of blood, but during pregnancy, they can add like more 2.5 liters, going up around 7.5 or 7 liters of blood. Mm? This increased the volume in blood. Uh, the blood tends to be dilute due to low hemoglobin levels. The volume is high, but the level of hemoglobin concentration is low. So their blood becomes dilute. They develop a condition we call hemodilution. Mm? It is very common in pregnancy. That's why uh, when you become pregnant, you're supposed to visit your midwife, gynecologist, or any healthcare provider where they will assess you and give you some supplement like iron or iron with uh, folic acid that will help you to increase on the level of HB hemoglobin in your blood. So this hemoglobin, when this level of hemoglobin is low, you develop a condition known physiological anemia. And physiological anemia is it might be normal and expected in pregnancy, but in other situations, it is always not good. Uh, so, uh, when the pregnancy grows old, pregnant mothers they tend to develop a shallow breathing. Why? It's because the other baby kind of compresses the diaphragm, and when the diaphragm is compressed, uh, the rate of breathing uh, is shallow. But because the body knows that this woman is pregnant and we have presence of a hormone called progesterone, this hormone progesterone helps a pregnant mother to relax the rib cages in order to facilitate the rate at which a pregnant mother can breathe in a bit well. Women who are pregnant, they also develop frequent urination, and the rate at which urination uh, increases with increase in the gestation age or an increase in the age of the pregnancy. This one occurs simply because the baby presses the urinary bladder. So when little urine goes in, the woman will feel that the bladder is full, goes and pass urine little at a time, little at a time. And also because of the increased blood saturation in a pregnant mother, increased blood saturation that goes through the kidney nephrons, the rate of production of urine also increases slightly. And that's why a woman will always keep on passing urine uh, even after a short time. And this condition, it sometimes predisposes these women to urinary tract infection because all the time they are visiting the what? The urinary, uh, the urinary house or the urinal. In that process, they are likely to pick some infection into their system. And also the level of pH of the urinary system. That is how it increases into an alkaline state, which gives a chance for these microorganisms also to multiply at a faster rate than when they're in an acidic condition. During pregnancy, there is a condition we call they develop uh, pigmentation of the nipple and abdomen. In the abdomen, there are veins that develop. There is a middle vein that developed called uh, the linea nigrum. The linea nigrum, this line develops uh, due to increased pigmentation due to hormonal changes. Some women they develop a condition known as morning sickness, where you find a woman uh, feels like vomiting every morning or every evening. Every morning is weak. Uh, this happens due to it's common in pregnancy due to those hormone that changes. Mm. Also in pregnancy, we develop a condition of increased heartbeat. Some women will always have their heart rate increased. Mm. That's one of the other physiological changes that occurs during pregnancy. In pregnancy, we expect a progressive increase in the abdominal size. As the baby grows, we expect the abdominal size to also increase in size. And on top of the increase in the abdominal size, also we expect the size, the weight of the mother also increase. So someone by the end of her pregnancy, you find that has developed, has added like 24 kilograms on average. Mhm. So there are a number of changes, of course, that occurs. We might not exhaust all, but those are some of the changes that occurs during what? During pregnancy. Normal physiological changes. In brief, when you're pregnant, expect some of these changes. Amenorrhea, which is absence of uh, menstrual flow, mood changes due to uh, the hormones that are produced by the growing fetus, like HCG, human gonadotrophic hormone. We have hormone progesterone and hormone estrogen. We expect increased blood volume and saturation, which might end up leading into hemodilution and increased urine output. We expect shallow breathing, which was also assisted by hormone progesterone to where the hormone relaxes the rib cages to enable a woman breathe at ease. We expect pigmentation of the nipples and sometimes itching, also pigmentation of the linea alba. uh, Morning sickness, sometimes it happens, though some women they may dodge it, but it is common in uh, almost all women. Increased the uh, heartbeat or palpitations, and heartburn, sometimes called this kind of esophagitis, due to the compression of the stomach by the growing fetus. There is also sometimes the lips become dry due to I think eating habits and the vomiting style. There is also craving for specific foods, a condition we call pica. There are even other signs that we might have not exhausted, but kindly, when you get such some of those signs, you need to see your uh, midwife, gynecologist, or any healthcare provider for quick assistance. So the next time we meet, we shall talk about uh, the danger signs that occurs in pregnancy. Don't forget to like, subscribe, share, and click on the notification bell for more exciting videos at Talk to Your Doctor by Dr. Bagonza Stephen. Amen.